Accessing services for those with disabilities is crucial, but the wait can be a challenge. On this episode, you'll hear about the wait list and how to start the process.
Whether you live in or just love Johnson County, Kansas, JoCo on the Go has everything Johnson County. Here's what's happening and what's coming up in the community you call home.
Thanks for joining us for JoCo on the Go. I'm your host, Teresa Freed, a Johnson County resident and employee of Johnson County government. Today, we're talking with Johnson County Developmental Supports experts about the services provided through its Community Developmental Disability Organization. So first, I'd like to introduce you to Mandy Flowers. She's the Johnson County Cddo director. And we also have with us Melissa Reeves. And Melissa, can you talk about your role with the county?
Yeah, so I am the community relations manager. So I do all things communications and outreach for the service provider side of JCDS, and I also support communications for the Cddo.
All right. And so we're talking about the wait list today, and it feels like we hear about this quite a bit whenever there's a discussion about disabilities. And so can we talk a little bit about what the wait list is and what Johnson County's role is in helping people to get on that?
Sure. The HCBS, which is the Home and Community-Based Services Waiver, is through our state, and it's a program through the federal government. And so when we talk about this, we hear a lot about waiting lists, and there's a lot of, you'll hear on the news, the 9 years that you wait on the waiting list, things like that. For Johnson County, the Cddo is a single point of entry for everyone who an intellectual or developmental disability in the county. So we manage that through, we determine the eligibility, if they're qualified for this program. This program is the program that helps children when they get older receive day program services, supported employment, group home living, whatever they need to meet their preferred lifestyle and independence. And we're a lifelong waiver. So we are with your family until eligibility, all the way through the process, living in a group home or whatever they choose to do. We work very closely when children are young with our school districts throughout Johnson County. We work with them to identify children who would be eligible for the waiting list, and we also work with them to help them understand what that process is. We understand that our families and parents in Johnson County are very busy. They're working, they have other children, other things going on. So think about services when somebody is an adult, when your child's 7 years old. We understand that that's probably going to be on the back burner. So at the Cddo, we're trying to help everyone understand this process and get on this waiting list. So when their children are graduating from high school or ready to move on to their adult life, their service is in place. While the child is on the waiting list and going to school, there's a variety of things that we can do. We help them with resources to understand that there are other programs that can support them throughout Johnson County. They can also, after they qualify for an MCO for insurance, after they qualify for that, then they can get a case manager. And that case manager is very key in helping families navigate the system and know what's available for them in regards to services to help their children through those developmental milestones, and also through just the hubbub and how hard it is finding time for everything and raising your families and doing everything you need to do on a daily basis.
In the state of Kansas, you can get on the waiting list as young as 5. So as Mandy mentioned, the waiting list right now stands at about 9 years long. So that's why it's so important to get on the waiting list as soon as you can, as soon as the age of 5, if you have a diagnosis by the time that the child is 5. Getting on that waiting list ASAP is a priority.
Absolutely. And it's not for your family and what they need to do for your child and loved one. It's also good for what we like to refer to as our overall service system. If we have folks that we have on the waiting list and we know their ages, then we can start planning for what kind of services are we going to have available and ready 10 years, 15 years down the road. So we can start preparing. We have providers throughout the community that provide these services. And so we want to give them an opportunity to help build up their infrastructure, build up their supports they have, so we can meet this need throughout the years and the future years to come, because there is a need. And right now we talk about the waiting list, and I know there's always discussion, and it sounds like a great idea. Why don't we just fund the waiting list right now for the entire state? That would be fantastic. However, our providers don't have what we like to call capacity, the room or the resources available for that. So getting on that waiting list also helps the overall service system, so we can start planning for our future needs throughout Johnson County as well as the state.
All right, great information there. And Melissa, do you want to talk about the campaign to get people onto the wait list?
Yeah, so this year, the Cddo kicked off the Close the Gap campaign. And what this campaign aims to do is to close that gap in services between high school and adulthood. Because a lot of the times, our public schools are fantastic, and a lot of students with disabilities, they have access to paras and other services through the school system. And then what often happens is that the parents aren't able to get the kid on the waiting list because they really didn't know about it until the child is about to graduate. And now they're in the back of the line for a 9-year wait. And so there's this huge gap in services where they were getting their needs largely met, and now they're at home and they're working with their family to try to build on what they learned in school. So what we want to do is we want to educate parents and students to get on the waiting list early, so when they do graduate from high school, they're going right into adult services and there's no gap there. So we launched a website, closethegapjoco.org. And what this website does is it takes this really complicated system and it makes it easier for families to understand. So if you go to the website, you can learn all about the process of getting an assessment and what the waiting list actually is, what services and resources are available, what are home and community-based services, all of these things that can be a little overwhelming at first for families. So we aim to really break that down and make it more simple.
That's great. And so people might be wondering then, is that the starting point? That's the first place they go to start the process, or do they go through a portal on the state's website, or how do you initiate the process?
So that is the Cddo, as Mandy said, is the first point of entry for IDD services. So the Cddo runs that site, and there's an option there to be contacted. And once you are contacted, that kicks off the process. And the Cddo staff will reach out to you and start the assessment process. And Mandy can talk a little bit more about what that assessment process looks like.
Absolutely. So when you reach out, and we will reach out to you, and we will need some documentation, diagnosis, things like that. And then we start that application. And then the second step is determining eligibility. And so after we get all of that paperwork back, we will have an eligibility staff come out and meet with your family. Zoom, if you prefer, will meet with you and determine if you're eligible for HCBS services. And then we will also let you know of some resources that are immediately available to you and your child.
Okay. And so does the initial contact with the Cddo, is that when the 9-year wait starts, or is it when the application is complete? And how long can that process take?
So after our eligibility specialist meets with a family, they will come in and turn in their assessment to the state. And right then, when that is submitted, if they are eligible, that starts their waiting list date, is the day that we submit that. Also statute that we have a certain timeline that we need to get that done. 45 days is typically around the time that it takes us to go through all of those steps, because we want to get folks on the waiting list, to get that waiting list date as soon as possible. We can start that wait and start with a service preparation.
And just to kind of look at the big picture, what kind of a difference in a life can it make receiving these services?
Absolutely. Melissa touched briefly on, somebody might be graduating and then they just find out about the Cddo and they have to wait 9 years. In school, the folks that we support have made wonderful strides towards independence, towards a variety of things. And so if there's not that consistency with using those skills, there can be regression. And that means that maybe folks will forget how to do some of that stuff that makes them so independent. And that's what we want to do. We want to avoid that gap, because there's regression where the person who's done a great job during school may not be going into group homes with the same amount of skills to be as independent as possible that they once had. We also want to close that gap because we know what a burden that is on our families. If you find out your child's graduating and you need someone at home with them and you work, that causes a lot of stress and strain and difficult situations and conversations for families. So we really want to help get away from that so we can support everyone in Johnson County in the way that's best for them and helps them be as independent as possible.
And also the transition from high school to adulthood is difficult. It's difficult all around. And getting connected to the Cddo also connects families to resources like employment support and how to build a resume and how to actually look for competitive employment. And these are services that I know a lot of people would benefit from. And if you have the added layer of having an IDD, then it's good to go to a place that understands your disability and can understand how to tailor what you need to what your actual goals, abilities, and limitations are.
Absolutely, Melissa, you're absolutely right. And with that, when we can do that, when we have somebody who's on the waiting list, there's also different programs that people might be eligible for and may want to do based on choice. There's a new state program called the STEPS program, and that is to help people obtain employment with some case management services. There's Project Search that can teach people skills to do jobs, internships, things like that. Real great programs that can be accessed while you're on the waiting list. So just to help build up those skills and really see what folks want to do and give them that opportunity.
All right. Well, that's great information. I guess, some families may have some questions about the cost. The services provided through Johnson County, is there a cost associated with that?
No, there's no cost. That will be, all of this is a federal program through Home and Community-Based Services. So that is paid for by the federal government as well as state government. So there's no cost to families. And I know a lot of people can be concerned and think, holy cow, this is a lifelong program. That's going to be really expensive. Studies have indicated that this push to help people live the life that they want in the communities that they want. Previous to this, unfortunately, a lot of people we serve would be put in state hospitals and not have choice. Financially, it's been demonstrated that home and community-based services are actually cheaper than putting someone in an institution where they are not getting the choice or not living to their fullest potential. So it's a great program, and this costs nothing to our families to be a part of.
And one other aspect of this campaign that we created is also educating the public on the advocacy that's needed in order to continue to fund the services. Like Mandy said, it's state and federal funding. And so one of the things that we do is we try to educate our elected officials on the needs in our community for IDD services. So if you go to the website, there's a section called advocacy where you can learn about bills that are going through the state, going through the federal government, how to contact your legislators, and just make sure that your voice is heard as we try to build capacity and increase reimbursement rates so we can continue to offer these services in our community.
Absolutely.
All right.
One thing that's very exciting about this, our Close the Gap campaign is this is a very tricky program, and it's a tricky program for people who work in it. So another one of our goals, and I think a highlight of this program, is we'll be able to help educate families on how to get through these programs and understand them, because it's very difficult when you work in this field full time. So if you have multiple children or jobs, or you're going to school, it can be almost impossible to understand this. So we're hoping and we're excited that this will also be an avenue for people to understand the whole service system and the needs that we have in our system.
All right. Great information. Thank you both for joining us today. And if you could just tell us that website one more time where people need to go to start the process.
It's closethegapjoco.org.
Perfect. All right. Well, thank you again. And everyone, thank you for listening.
You just heard JoCo on the Go. Join us next time for more Everything Johnson County. Have a topic you want to discuss? We want to hear from you. Follow us on Facebook and Twitter at JoCoGov. For more on this podcast, visit jocogov.org/podcast. Thanks for listening.